Okay, this is another way to lengthen out some of the tissue. Again, fascia, muscles, uh, down this front kind of side into the thigh area. And also use some of your rotation in your hips. So you're going to be on your back. So you're just going to find, let your body settle down on your back. And as always, I always remind you, if you're someone that needs head support, don't be shy. Don't be hanging out like this doing your exercise. So feel free to use a rolled towel or any type of small Pilates pillow or anything that you need to support yourself. So what you're going to do is you're going to widen your feet so they're more than hip width apart. And then you're slowly going to let both knees fall to one side, kind of like a windshield wiper, if you will. Think a little bit kind of like a spinal twist. You will get some rotation here. And what you want to feel is that the leg that's turning inward, right? One of your legs is falling out, the other one's turning in. The one that's turning inward, you want to see if you can feel just some lengthening and a little bit of a stretch through this front kind of outer hip area, right through there. It shouldn't hurt. So you always want to feel like you're moving slowly into positions of stretching or mobility, because your body might send you a signal that's like, oh, I don't know if I like this, and you should listen to that. Okay. So what am I thinking about here? I'm not letting my low back arch dramatically in this position, because if you do, you will feel this in your low back. So I am consciously, very lightly, just allowing my back to stay as grounded as possible. It's not flat. I'm not tucking, but I'm allowing my back to stay settled into the floor and not come into this dramatic arch, because that might not feel the greatest, and it's really going to not help us target what we're trying to target. And you could just move back and forth with this. Again, your feet are wide so you can allow this mobility to happen. We're getting some rotation through the hip joint here, through the pelvis, a little bit through the spine. Ooh, my leg's jumping a little bit because it's like, I don't know, do I want to stretch? And this, it should feel good. Stretching should feel good. It shouldn't feel so intense that you're, convulsing or you can't wait to get out of the position. You should feel like it's like, oh, it's kind of light. I can hang out here. I can breathe. I can let my body settle. And then as you come back, you are imprinting. So you're using those deep abdominals to assist in getting the legs back up. Okay, my body's very grounded into the floor. And then this is about all you do side to side. If you let stretch, you could hang out there for maybe 10 to 15 seconds. Let your body, let gravity take you. Sometimes the legs will shift. Let them, and let them allow yourself to sink and relax into the position.